Welcome back. Well, graduations are behind us this semester, but there is a growing trend. More and more graduates are getting plastic surgery as graduation gifts. Here to talk about that is Dr. Jennifer Walden, a cosmetic plastic surgeon. Thank you for being with us today. Talk about what kind of surgeries we're seeing as graduation gifts.
Well, in general, women who have turned 18 may want to get a breast augmentation. They may need breast reduction, ear pinning surgeries for kids who've had prominent ears, a rhinoplasty or nose job, surgery to alleviate male breast enlargement, for example, and even liposuction sometimes.
So we're seeing this in both male and females.
Exactly.
And is there any concern with the age that the bodies may still be growing? Is there any safety concerns?
Sure. I mean, teenagers need to be emotionally ready for a permanent change in their body after undergoing surgery. Parents need to definitely be on board and supportive. They should have researched the procedures out and be able to take the time off of sports, camps, any type of summer school they may be doing to recover from these procedures so they don't end up with a complication.
And I guess that's one thing to point out. What should people do if they are considering plastic surgery? What should they do ahead of time? Ahead
of time, they should do their research, talk to their parents about it, go and see several different board-certified plastic surgeons who are well-versed in doing that particular procedure, and just be emotionally ready for a permanent change in their physical appearance that could happen after the surgery.
So are you, being a plastic surgeon, are you shocked by this trend? I mean, how have you seen the procedures kind of change over recent years?
Well, I'm not shocked completely because there's a growing trend for plastic surgery in all age ranges. And basically with teenagers getting plastic surgery, it kind of goes along with plastic surgery being more accessible, pervasive in our media. We have such a visually oriented society with Facebook, Instagram, and TV images that it's not uncommon for teenagers to want to and be able to change their appearance for the better at that juncture between going off from high school to college.
And a big part of it would be education, both with the patient and with the family involved, right?
Absolutely. Absolutely. It has to be a win-win arrangement between plastic surgeon, family, parents, and the patient getting the surgery.
And this is not just for people, being vain. This is sometimes what they consider a necessity, or just to kind of feel like they fit in.
Absolutely. This is not an exercise in vanity. A lot of these surgeries help correct a very embarrassing body part, such as breast enlargement on a teenage boy, or prominent ears, or a hooked nose, and it helps them to establish self-esteem and confidence before venturing off on this new leg of their life.
What's the range of recovery that we're talking? Obviously, there's a lot of different procedures, but what are we looking at?
Well, it varies for procedure, but just in general, I tell my patients you need to take 5 to 7 days off of work or school. For a young teenager, they're going to need to take about 4 weeks off of any type of sporting activity, 6 weeks off of contact sports like football.
And does the the heat that we have over summer, can that have an effect on it, or just kind of R&R?
Well, R&R is always good after a surgical procedure, but sunblock is very important when you've had an operation that's on its sun-exposed area of your face. And also, yes, staying inside and recuperating in the air conditioning, just because swelling can happen with all of the heat.
Okay, very interesting stuff. Thank you so much for being with us, Dr. Jennifer Walden.